Hello, Happy New Year. I hope you are having a wonderful February. It's hard to believe this has started already. I don't even know where January went. I do hope that you had a very good holiday season and that all is well with you. So we have some new things to announce. We have a new visitor management system as you go into all of our facilities. It started in Vineland and it's going to be rolled out. You'll probably interact with it as you come in. We will ask you for your ID. We will scan your ID. We'll give you a tag with your picture and where you're going so we can keep track of that, so we know how many people are upstairs and make sure that we can keep track of the visitors. The most important part for us is that in an emergency, we know how many people are in the house and we can make sure that we can get you out safely. So I ask for your patience as we roll out this new technology. Your safety is our top priority, and so this is one way that we continue to encourage to look for ways to make sure that we keep you safe while you're in our facilities. I wanted to start out recognizing Black History Month, and as part of that work, it's important for us to revisit how the history has impacted people in our own community and maybe even within our own family. And so I'd like to tell you about a member of our family, Dr. William King, who was an Underwood physician. Dr. King had a private practice, was very active, went door to door. There are so many wonderful stories about the great work that Dr. King had done. Unfortunately, he was denied staff privileges based upon his race, and the local NAACP chapter went to court and actually won for Dr. King to be awarded privileges. The rest of the story is the powerful part. Dr. King went on to not only be a member of the staff, but he went on to run the residency program for family medicine and actually become the chair of the family medicine program. That to me is the wonderful part of the story. The entry was not what any of us would have wanted as we look back today, but what happened after that was the inclusion, the full embracement, and really looking at the talents that Dr. King brought to the table. We are honored that we have the legacy of Dr. William King that taught us lessons, gave so much to our community, and that we cherish today all the work and dedication he did, not only for our community, but for Underwood Memorial. So February marks Heart Month. You'll see that I'm in red today, and you're going to see as you drive by at night, our buildings will be in red as a recognition for Heart Month. We are so privileged to be part of a relationship with Cooper in the Cooper and Spira Cardiac Care with 80 physicians serving over 17 locations. Our top priority is to make sure that you get the care you need as close to home as possible. And because of the expansion that we've done in our cardiac programs, much of that care can be delivered either in Mullica Hill or in Vineland. And we're so very grateful for all of our partners, all of our cardiologists who work so very hard to make sure that we keep our patients safe and happy and most importantly, healthy. And so that leads me into my story of the day, which is of Carol Johns from Egg Harbor. See, at age 55, she retired as an executive assistant. She retired early because she really wanted that full amount of time to be able to share with her family. And so she was very engaged with her family. They had an organic farm and they raised chickens. And so as she got into her 70s, she was building the chicken run and she felt a slight pain in her chest. But she thought, you know what? I was just out here doing activity. It's really, it's nothing to worry about. So she went to bed that night and sure enough, she woke up with significant pain. She did what many people do. She Googled the symptom, and sure enough, it said heart attack. So she immediately texted her daughter-in-law, and she put heart with a question mark, and they immediately got her to Vineland. Fortunately for her, the team there was able to immediately address her issues. Dr. Chung ran the test, and sure enough, she was in a cardiac episode. So Dr. Chung reached out to his colleague, Dr. Rafek, and he was able to do a coronary angioplasty and put in 2 stents right away. So Carol thrived and was doing well, but she knew that she needed to do her follow-up with Dr. Levy, and in that period of time, she knew she would have to have another elective procedure. All of that is very normal, right? We have in that emergency situation, we make sure we do our follow-up work, and there may be other things to do, but the most important thing is what Carol felt. Actually, what she said was that she felt that they were the ministering angels, really walking her through each step of this process. But the real message was that Carol said that nobody was more surprised than she was. See, she was living a full life. She was doing all the things she wanted to do. She was working in the yard. She never had a real health issue. But that's why it's so critically important that we listen to our bodies. And so I just really want to thank Carol for the trust she put in all of us and all of our team members. I want to thank the team members for the great work they do every single day. This is just one story of thousands of stories that happen, but it's important to tell you that for a couple of reasons. One, I want to make sure you know that these services are literally right in your backyard. We have expert, talented physicians who are here to make sure that they care for you. They've been caring for you all along. And most importantly, that we are honored to provide that care, and we know you have choices about where you can go for that care. So we are grateful at Carol, we're grateful to our providers, and we're grateful to you for the continued trust you put in Inspira Health. Until we meet again, be well and stay safe.